We started this campaign when we heard of the plans, the proposals to close the A&E at Lewisham and the maternity. Now these proposals have now gone to Jeremy Hunt, who's the Secretary of State for Health, and he'll make his decision on the 1st of February. Before then, we want to have a huge demonstration, 26th of January, to tell Hunt that his plans are totally unacceptable. Because Lewisham Hospital is a thriving, busy, popular, and well-performing clinically and solvent local hospital. If the A&E closes, it means the whole hospital will close, because the A&E is like the front door of the hospital. It's where they admit all their urgent patients. So that means all the medical and surgical and children's wards will close as well, that care for urgently or seriously ill patients. If the maternity closes, most of the maternity cases in Lewisham won't be able to go there. They're just going to have a midwife-led unit, which is all right if you've got very low-risk births. Many births start off low risk, but things can go wrong in labour, and then women will have to be transferred in labour to other maternities locally, like Queen Elizabeth Hospital maternity or King's College Hospital maternity. Interestingly, last week both Queen Elizabeth maternity and King's maternity were full up and were turning pregnant women in labour away and diverting them to Lewisham Hospital. So can you imagine what will happen when Lewisham Hospital's maternity is closed? This issue is not just about Lewisham though, because the proposals which have been put forward are to cut over 400 nurses, doctors and other health workers' jobs from across Greenwich, Bexley and Bromley as well as Lewisham, and to close and reduce services across the whole of South East London. So we're hoping that people from beyond Lewisham will realise that a fight to defend Lewisham Hospital is a fight that will help defend health services right across South East London. And a victory for Lewisham Hospital is a victory for everybody. On the other hand, if Lewisham Hospital can be closed, as I said, a busy, popular, solvent, well-performing hospital, on a flimsy pretext, then any hospital can be closed. No hospital is safe across the whole of England. So this is a crucial test case fight, and that's why we think people from far beyond Lewisham should take this fight very seriously and come and help and support us. We've built a massive campaign. It's amazing. It's inspiring. We had a demonstration over 10,000 people, which we organised in a couple of weeks, and the next one is going to be even bigger. We've had huge public meetings. We've got over 40,000 people signing petitions. We have street stalls every Saturday. People are just queuing up to lend their support to the campaign. Not only that, but all the doctors in Lewisham, all the GPs and all the hospital doctors are completely opposed to these plans, as well as all the other health workers, nurses and everybody who works in healthcare in Lewisham. All the churches and the other religious organisations. There are people in the local mosque who have been campaigning to support the hospital. The Church of England and the Roman Catholic Church and some of the Baptist churches. So we've got a really broad breadth. All the Lewisham pensioners are supporting the campaign. Mums who care about the maternity and the children's services are being very active. The unions are very involved. The doctors, as I said, I'm a local GP, are really angry about this because we know how important it is for our patients to have a good local hospital. So we think that because of all this unity across the borough, and also because we've got all the arguments are in our favour, the arguments to close it are really flimsy and based on really dodgy statistics and wrong assumptions. But we feel we've got a very good case, and we feel we can put huge pressure on Jeremy Hunt. And this is the first major decision he'll be making as Secretary of State for Health. We don't think he should make a mistake with this, and I think if he agrees to the closure of Lewisham Hospital, that will be a huge political mistake for him. We want him to realise that he'll pay a huge political price if he goes ahead with this crazy idea. Thank you.